So as we come to the end of today's session, we'd like to take a moment to reflect on all the rich discussions, the wealth of knowledge shared, and the inspiring experiences that have unfolded throughout our time together.
We started the day with session 1, diving deep into the world of rare bleeding disorders, von Willebrand disease, and acquired hemophilia A. Dr. Hayward, Dr. Lillicrep, who we actually should have invited up for the To Infinity and Beyond because your arm actions are on point. Dr. Lee and Dr. Khalife highlighted the latest diagnostic and treatment approaches, while Donna Cocker's powerful patient journey reminded us of the human side of these complex conditions. It's clear that we are continuing to push the boundaries of what we know and how we treat these disorders, all thanks to the dedicated professionals and brave patients sharing their stories.
In session 2, we addressed critical aspects of reproductive health and sexuality. We heard the experts like Charity Fan, Dr. Katz, and Dr. Winikoff, and we're fortunate to have Justin Smertz share his personal journey with us. The sessions on family planning, genetic counseling, and hormonal therapy have certainly given us a lot to think about as we consider the unique reproductive, oh my goodness.
It's late.
It's the end of the day.
We need a break.
Yeah, you got it. The unique reproductive health needs of those with a bleeding disorder. And of course, the discussion on sexual health is an essential part of the holistic care that we should continue to prioritize moving forward.
Let's talk about sex, baby. No. Yeah? No? Good? Okay. After our well-deserved lunch break, we returned for session 3, Bleeding Disorders Through the Lifespan. The panel on aging with a bleeding disorder provided a comprehensive and interactive discussion on the unique challenges faced by our aging population. Thank you to the panel for your thoughtful contributions, especially to Tony Tavares for giving us so much of his story to really help us understand aging with a bleeding disorder. We also had an enlightening presentation on mental health literacy by Dr. Pedro and Julia Hughes-Gerard, which is an often overlooked yet critical aspect of managing chronic conditions like bleeding disorders.
The speech thing is contagious.
It is.
It is. Finally, in session 4, we explored hot topics in the field, from new frontiers in hemophilia treatment with Dr. Matino to joint health with non-factor therapies with Dr. Strike, and the patient perspectives on novel therapies panel was an eye-opening session showing the real-world impact of treatment innovations and complex decision-making involved. We heard powerful voices from the patient community, each one adding valuable insight and on their treatment journey.
As we conclude today's sessions, we want to thank each of our speakers, facilitators, panelists, and participants for making this conference such a success. Your passion, your dedication, and your willingness to share knowledge, experiences, and expertise have made a lasting impact.
Let's take these lessons learned here today and continue to work together to improve care, support, and advocate for those living with a bleeding disorder. The dialogue does not end here. We'll continue to push forward, challenge the status quo, and innovate in ways that will make a real difference.
Thank you all again for your time, your engagement, and your commitment to advancing the care for people living with bleeding disorders. We look forward to seeing everyone at future events, continuing these important discussions, and building on the progress that we've made together. Please do not forget to fill out your evaluations to help us continue to shape these symposiums. We did use all of the feedback from the last symposium to develop this one. And finally, go Jets. 8 p.m. tonight, team. 8 p.m. We got this.
Go Leafs. I would like to invite Dr. PARDY and EMIL WIJNKER back to the stage for a few closing remarks. And on behalf of Julia and myself, thank you for the opportunity to serve you as MCs today.
So the theme today was To Infinity and Beyond. I'll do the little action. A changing world of bleeding disorders care. So Julia and Nancy, who did a wonderful job, just recapped for us all the things that we heard about and learned about today. And I want to thank the planning committee and all the speakers for bringing that theme to life. In listening to today's agenda, particularly the last panel, I'm reminded of another quote about aiming high. Shoot for the moon, even if you miss, you'll land among the stars. So wouldn't it be nice? Wouldn't the stars be a nice place to land? I challenge everyone to take what you learned today, to get involved in whatever way you can, so that we as a community can land among the stars.
Thank you, Dr. Pardy. No, I get the fun part. All right, we now get to invite everyone to please join us for our Rendezvous cocktail reception in the exhibit area right now. Come and enjoy refreshments and connect with new and old friends. Thank you all for a wonderful day. Merci beaucoup.